Hi, everybody. We are in Unit 8, Clinical Psychology, and this is going to be modules 70 and 71. We are getting into the treatment of psychological disorders. And I'm starting here today at a comfortable spot that in kind of a quiet place of my home where I like to reflect. And I think that that's just finding those places where when you're struggling, whether it's, you have a psychological disorder that you've been diagnosed with, or you're just having trouble, when it comes to school or family or relationships, that you have that quiet place away from distractions and an opportunity, whether it's meditation and other forms of therapy. But today we are going to specifically get into some of the different theories and treatments based on the theories that we actually covered. Sorry, here, we're going to get to the beginning, that we covered in the personality unit and also at the beginning of the year when we talked about the different perspectives. So the first module is going to be the introduction, psychodynamic and humanistic therapies. And I am going to go through things relatively quickly, but giving you some background information. So we're going to talk about psychotherapy, which is more where you have a trained therapist and you're working through psychological difficulties, trying to acquire growth and improve behaviors or thoughts. Biomedical therapy is going to be more of where you're working with things like receiving medication, or maybe there might be some type of, they even have things called electroconvulsive therapy or deep brain stimulation, which is different than more of like the coaching and the relationship building that you would receive in psychotherapy. Today, we're talking more about psychotherapy. It is very similar. I should back up to that previous slide. It's very similar to the perspectives and approaches. And when you understand and know the perspectives, you can make predictions of how they might treat somebody with a psychological disorder. All right, so, I think I'm going the wrong, let's go back. All right, there we go. So one thing to also understand is that most therapists use a combination. So they might be primarily a psychodynamic therapist, but they also might give medication or refer you to a psychiatrist. So it's going to be an eclectic, which is a blend of therapies. Okay, for some reason I keep going in the wrong direction. Let's keep going. All right, so here's a question. Dr. Carlson advises his depressed patients to discuss their childhood as well as their present lives. He also prescribes medications for them. His therapeutic style would best be described as eclectic. So we're going to get into the first type of therapy, and it is called psychoanalysis. And psychoanalysis came from Freud, remember, and he was talking about that we have internal unconscious forces that are going to be affecting our feelings and our behaviors. And his therapeutic method was to bring insight for you to start to and bring out those underlying conflicts. He believed that you could achieve a healthier, less anxious living by releasing the energy. So a lot of it, he might focus on things like, what is the conflict between the id, ego, and superego? And how are you repressing certain feelings, maybe experiences from your childhood? We talked about free association in the personality unit, and he would just have you say the first things that are coming to mind, and you might relate a childhood memory, you might talk about a dream, and then what he would do is he would recognize when the anxiety laden material that was coming up into your consciousness, that there might be certain things that might happen through that therapeutic process. And one thing is called resistance. And resistance would be that when it's causing you to feel uncomfortable and it's causing anxiety, that you would resist it, and think of, knowing the word in other contexts. So you're going to defend against the sensitive material. So maybe even a defense mechanism would be an example of resistance. And then he would provide you insight. What do his psychodynamic therapists call the blocking of anxiety-laden material from conscious awareness? Resistance. Yes. And there is a big form of what you will do during a psychodynamic or psychoanalytic therapy session is that the therapist will provide interpretation, which is going to be their overall opinion. It could be very subjective, and they're going to kind of explain to you why they think that you are having these particular feelings or emotions, and what it could stem from. Another part of the process is something also could happen. So you have to understand that with psychoanalytic and psychodynamic, or actually the psychoanalytic is a very long time period that goes by through the therapy session. So like maybe 6 months, maybe meeting several times a week. And you are developing this relationship with your therapist because you're spending a lot of time and you're talking about, very important relationships that you have with family members and experiences that happened in your childhood. And one thing that could actually happen is whatever, maybe you're having a conflict, let's say like with your mom, and you are talking about and experiencing emotions when you're thinking about this conflict that you have with your mom, and it might get transferred onto the therapist. So it's almost like you are treating and acting like the therapist is your mother. That's transference. And I will say that most therapists today are not actually psychoanalytic therapists. It says North American therapists, uh, because it's not really supported by scientific research. There isn't a lot of evidence. So there could be a lot of different interpretations. I talked to you about it being subjective. And so most therapists that might follow some of Freud's ideas are what we call psychodynamic therapists. And they don't really talk about the id, ego, and super ego. They're going to talk more about the relationships that you're having, maybe things that could stem from childhood and some of those experiences. So, psychodynamic approach, it's not going to be as intense where you're meeting several times a week. You might just meet once a week, and it could be for a few months. So psychoanalytic, psychodynamic are considered insight therapies. And we're also going to talk about another insight therapy. And insight therapy, just as you would predict, you're gaining insight that through, talking and working through some of those conflicts, you're going to become more self-aware and understand more about your own motives and defenses. So we're going to also talk about the humanistic perspective. Humanists, as you remember us talking about them, they believe that people are basically good. They just need opportunities to reach their fullest potential and to have self-awareness and self-acceptance, and that you should take responsibility for your feelings and actions and promote growth and through this therapy. And they call it client-centered therapy. And it's not so with the psychoanalytic approach, it's more about the unconscious. With the humanistic approach, it's more about the conscious thoughts, that you're aware of. As I mentioned, humanistic therapy is focused on what we call client-centered therapy. So let's say you went to a client-centered or to a humanistic therapy session, that they would have you be centered on kind of developing and being actively involved in how you want the therapy session to go. So we call it non-directive therapy. So they're going to listen without judging and interpreting, and just allow kind of you to guide yourself through the therapy. They believe that you can have growth by the therapist exhibiting acceptance, genuineness, and empathy. And you want to feel unconditionally accepted. And they use something called active listening, which is echoing, restating, seeking clarification. You've probably heard of active listening. I think we talk about it a lot in middle school and stuff, when you're having conflicts to learn. Here, I think we got some examples. I'll give you some examples of active listening in a second, but through that process of active listening, it needs to be really clear that the relationship that you have with the therapist is that you see the therapist as having unconditional positive regard towards you. And we talked about this one before, is that you feel non-judged, you feel you're accepted, have a general acceptance and respect from the therapist. So here are what we mean by active listening. Paraphrasing, which is checking understanding and summarizing the person's words. Inviting clarification, like asking questions to clarify certain points. And then reflecting. So you reflect the feelings after you have already asked the question. So you might say, that sounds frustrating. No matter how embarrassing her discussions with her therapist might be, Jenny recognizes that he always treats her with respect. This acceptance illustrates the client-centered technique of, so remember, because it says acceptance, it's the unconditional positive regard, E. Okay, so now you can hear my dog in the background. And see, that's another part of my therapy is having my animal therapy here, my dog, although she makes noises. All right, so the next part of this, these modules, this is module 71, is the behavior, cognitive, and group therapies. And just as we've talked about behavioral techniques like classical and operant conditioning, we talked about cognition, like different forms of cognition. You might be able to predict how they might treat someone with a psychological disorder. All right, so as I mentioned, those were insight therapies, psychodynamic, humanistic. Behavioral therapists are focusing not on the unconscious thoughts and motives and drives. They're focusing on what actual behaviors exhibiting, what you're actually doing. So what are some of your maladaptive behaviors? And they use a lot of operant and classical conditioning techniques or use it to explain the behaviors. So one big thing a behavioral therapist might work with is fears and maybe like phobias. So, as you remember, you could end up being phobic, having a phobia of dogs because you had a very negative interaction. Maybe you were attacked by a dog. And so now just even, seeing a dog, you are afraid. So one therapy technique, they do something that's called counter conditioning. So rather than you having fear, they're going to try to counter that. So you will change that behavior and not be afraid of dogs anymore. So there's two types. It's called exposure therapy and aversive conditioning. And we're going to talk about those. So what is exposure therapy? Okay, so now we're going to dig deeper. In exposure therapy, you could do something called systematic desensitization, or you could do virtual reality. And systematic desensitization, I'll give more details, but you can predict that with a virtual reality, they're going to put you in a virtual, with virtual reality goggles, and they're going to simulate you actually experiencing, having an interaction with a dog. And obviously at first you're going to be fearful, but over time they're going to help you so you have feelings of calmness and not having anxiety when you see the dog. But I'm going to talk more specifically about systematic desensitization. Remember, that is a type of counter conditioning. And what you're going to do, so we'll keep giving this dog example. So they are going to slowly get you to not associate the dog with being fearful, but get it to actually be associated with something pleasant and calm. Just as I see, Aggie, I certainly am not afraid. She actually makes me feel calmer. So they do something slower, step by step. And so maybe it might start with just talking about dogs. But while you're talking about dogs, they might have, like a candle and some, nice music in the background. And eventually you're just going to feel really calm when talking about the dog. And then maybe the next thing they'll do is show you a picture of the dog. And they call it a hierarchy of relaxation methods. So this is another example with flying, that you may first learn to relax by looking at airline sale ads, and then drive to the airport, and then visit a museum, and then eventually you might fly on a plane. And then virtual reality, it's going to be similar, but they're going to be using the simulated virtual experience. I feel like that might be good. My husband is actually, I'm looking at the one talking about, if you've got a fear of heights. My husband's very afraid of heights. I feel like a virtual reality simulation might help him to slowly get him to feel comfortable, although that would be scary to feel like you're walking on a bridge. Okay, so next we have something called aversive conditioning. And this one, you are going to associate an unpleasant state with an unwanted behavior. So it's trying to actually just get you to stop the bad habits. Really, a most common example we'll give is, like, let's say they tried aversive conditioning years ago to try to help people with alcohol addiction. And what they did was we know naturally that a drug, that makes you sick, the stimulus, if you get the drug, you're going to feel nauseous. So that would be the unconditioned response. What they did was they tainted the alcohol with the drug. And then, of course, they felt nauseous. So they brought people into the lab, said, here, have some drinks, and they had alcohol addictions. For like, okay, sure, we'll have some drinks. And they tainted the alcohol with something that made them really nauseous and sick. And so what they had hoped with the aversive conditioning is that they would associate alcohol in the future with getting sick, and then avoid the alcohol because of the nausea. So get them to stop drinking. But unfortunately, it didn't really work, because a lot of people, especially, you have higher level cognitive skills, you were able to recognize that it was only in that situation that you had this tainted alcohol, and that it wouldn't necessarily happen all the time. So it wasn't as strong. And it actually works better with animals than it does with humans. There's also something called behavior modification. And behavior modification is when we are just trying to modify, change behaviors. You could do it through rewarding when you're doing the right behaviors, or even setting up punishments for yourself for things that you consider undesirable. But it's an operant technique. So it's using those positive reinforcers, rewards, or negative reinforcers or punishments as you get closer and closer to the goal. All right, so I would say, I would love if we had more time to do behavior modification with you, because a lot of you talk about procrastinating, not getting your work done on time, avoiding your homework. So that would be the perfect example of something that you could use behavior modification. And then, setting up a little reward schedule for yourself. All right, so that was an example of a study of behavior modification. But we're going to skip over that. There is something else too on this operant conditioning topic, something called a token economy. And that is where you get a token, which is a positive reinforcer, a reward. And then, you could collect the tokens and then eventually turn them in for a larger reward. They use that in middle school a lot. For every 5 assignments they completed, Senorita Vale gives her students 1 homework puntos. They can, I don't speak Spanish, I'm sorry. No, I should. They can use those passes to opt out of future assignments. She is making use of a technique known as a token economy. All right, so one of the problems, a couple criticisms of behavior modification, how durable other behaviors, will people become so dependent on the extrinsic reward? So it just means you don't want to necessarily always be extrinsically rewarding something that maybe you would have eventually just intrinsically done. And is it right for one human to control another's behavior? So it almost seems like a behavior control, especially with like young children, like, you're going to turn into robots and follow everybody's direction by these tokens. And it feels too authoritarian. There is another type of therapy called cognitive therapy. Once again, just take that moment. Cognition, what is that? Well, that has to do with memories, thinking, language. So this therapy is going to focus more about your thoughts and what are some of your maladaptive or self-blaming over negative thoughts that you have. And here's an example. So some people, if you lose your job, you might have an internal belief like, I'm worthless, it's hopeless, which would maybe potentially lead to more depression. So that type of thinking could lead to depression, and lead to more of, or that you're showing more of those symptoms. But other people might have the exact same experience, but they might think things like, it wasn't a good fit, I deserve something better, which would lead you to not necessarily develop depression. So your emotional reactions are produced not directly by the event, but by the person's thoughts in response to the event. So just, think about what are some of your kind of negative thoughts. The first type of cognitive therapy is something called rational emotive behavioral therapy. And this one was, Albert Ellis created this. It's called REBT. And this particular approach was very confrontational. So he would vigorously challenge people's illogical, self-defeating attitudes and assumptions. And so if you said something like, I'm a failure, he would just be very confrontational. And how are you a failure? Give me evidence. Where is this, is this a rational thought? So the next person, Aaron Beck, he certainly believed that as well. And actually, I'm going to read through this little example of his. In the late 1960s, a woman left a party early. Things had not gone well. She felt disconnected from the other partygoers and assumed no one cared for her. A few days later, she visited cognitive therapist Aaron Beck, who challenged her thinking. Now, notice the wording here, not confrontational, but challenging. After then, she listed a dozen people who did care for her. Beck realized that challenging people's automatic negative thoughts could be therapeutic. Beck's cognitive therapy assumes that changing people's thinking can change their functioning. One big thing with our negative thinking, and take some time after this, go into your quiet spot and maybe reflect on some of your negative thoughts, is we might be catastrophizing. And that is really just seeing worst case scenario, taking things to an extreme. This test's probably going to be impossible. Everyone seems so relaxed and confident. I wish I were better prepared. I'm so nervous. I'll forget everything. So it's very extreme. So overall, the therapy techniques are reveal what your beliefs are, test them. So start to ask questions like, what's the evidence, and try to catastrophize the thinking, and then actually get you to change your overall beliefs and attitudes. Dr. Well tries to help her clients by teaching them to modify the way they think when under stress or experiencing symptoms. This means that Dr. Well engages in cognitive therapy. I like how they give these questions right after to get you familiar with some of the questions on the AP exam that are relative to that topic. So next is, we talked about cognitive therapy. So here we've got and we've talked about behavioral therapy. Now we have a combo, which is even better. It's cognitive behavioral therapy, CBT. And some of you, if you have gone to a therapist, which a lot of us have, that very much the most common thing you will see is cognitive behavioral therapy. So it is getting you to change your self-defeating thinking and change the behavior as well. Jane has been diagnosed with depression. Her therapist suggested that she get out and interact with her friends more, and that she not allow herself to worry about whether her friends want to be around her. Jane's therapist is using what type of approach to treat her depression? So notice the cognition, getting her to change her thoughts and also change her behavior, getting out more. So that is going to be A, cognitive behavioral therapy. So they guide people to new ways of explaining their good and bad experiences by recording positive events. So, grateful journaling and stuff like that. How she has enabled them. This woman may become more mindful of her self control and be more optimistic. All right, so the last thing we're going to talk about is group and family therapy. And this is conducted in groups rather than individuals. That would mean like more than 2 or 3 people. And you're going to benefit from the group interaction. In the case of group therapy, though, you will have a therapist with you, which is different than a support group. Family therapy is where you're treating people in the context of the family system. So you might meet with the individuals and talk about the family dynamic, and then also meet as a larger group as a family. So it might be kind of a combination. What are the benefits? With group therapy, helps more people, costs less, learning that others have similar problems, getting feedback on new ways of behaving. Family therapy, it helps family members identify their roles within the family social system. So you think you just kind of recognize this is your role, and these are some of the ways we need to improve our communication and try to prevent and resolve conflicts. And now, one of the last things I'm going to talk about is self-help groups. And this one, I am a huge supporter of self-help groups. 100 million Americans have belonged to small religious interests or support groups that meet regularly, with 9 or 10 reporting that the group members support each other emotionally. So what does that mean? There are all different types of support groups. I think some of the most common ones we've heard about is things like, oh, I got an email coming in, hold on. Is we have, so bereavement support groups. So if you've lost a family member, cancer support groups, if you have cancer, Alcohol Anonymous is a very big support network. And the point of it is that everybody is sharing in similar experiences. And sometimes we need that. You could be, let's say you are, have a lot of anxiety, social anxiety. And you could try to talk to your family about it. You can try to talk to your friends. You even can talk to your therapist about it. But they aren't fully going to understand because they aren't necessarily going through that same type of anxiety. So when you're in support groups, you are sharing similar stories and helping and guiding each other. So helping others in addition to helping yourself. So it's like a win-win. So I just can't encourage you enough. Please reach out to me. I have so many resources to get you set up with a particular self-help group. There are so many out there. And maybe, obviously right now, I guess a lot of it would be on Zoom, but there, you can go in person, but also you could go on Zoom. And maybe there might be a little awkwardness at first, and you don't even have to share. You can just sit and listen. And I think just hearing other people's stories can provide you so much support. So and then this is a good little, take a moment to kind of look this over. This kind of goes through the different types of therapy that we just covered today. And then remember, these are all psychotherapy. And then the next modules, we're going to talk about the biomedical therapy and then kind of compare and contrast them. All right. So I hope you have a very calm and peaceful day, and don't get too stressed about this AP exam. We're here to help you. Okay. Go to those review sessions. All right. Take care. Bye.